Dr. Fatima. So she will be presenting on slow motion dynamic videography, a tool for the diagnosis and evaluation of strabismus.
Some motions are so fast that they are difficult to analyze. Time is in fact an arbitrary human-made concept. While a second always takes place the same amount of time, the human internal clock is a metronome working at high variable velocities. A blink is 100 milliseconds. Pupil constricts in 200 milliseconds. The cover test, one of the most important tests for strabismus, appears simple but is actually complex. Eye shift in cover test takes place in 400 milliseconds. Slow motion to study fast-moving objects was first invented by Dr. August and has been used in sports since long. In medicine, it was introduced in 2013. We used this technique for the cover test. We took video during cover test on Android phone. The video was transferred to UCAD downloaded from Play Store. The video was copied twice and speed of 0.5x and 0.3x applied to the second and third video. This video was then played and replayed on the media player. Here we can see the exoporia becomes more apparent in slow motion. We decided to do a pilot study. A group of trainees were shown the cover test. After that, video recording of the cover test was made. And the recording was then showed to them in slow motion. They performed better with the slow motion technique. We published this data 2 months back. Slow motion dynamic videography of the cover test can be helpful in the detection and analysis of strabismus. It can also be used as a teaching tool for future generations.
Thank you. Over to the judges, please. No questions?
What is the message which you want to give to the house?
The message I want to give to the house is that using this new technique, we can actually record this eye movement, especially when we are evaluating the squints. And because it becomes so difficult to teach our students, and sometimes even like in nystagmus, when there is esotropia or when there is a small DVD, we might miss these things. So if we record this and then we replay, and we have got this software nowadays, we can use this technology and update our skills.
It means that if it is some very fast motion, accuracy to make it accurately, this slow motion may be
Yes,
such as
sir.
in cricket also.
Yes, sir. Yeah, when I saw this match, just like a third referee, he plays and replays in slow motion.
Make it slow motion.
Yes,
To
yes.
see the accuracy whether it is touched.
Exactly,
or not touched.
exactly.
What is the-
So when I used to teach in a class, when I found my trainees over there, they couldn't understand what I was doing when I was doing this cover test and prism bar and cover test. But when I showed them the slow motion technique after downloading in video, they were like, this is it. Oh, this is it. So it was it became very apparent. So it will become very easy for them to diagnose.
I think it is a good idea to give you a little more accurate view of what you are seeing. But how does it help your patient in clinical practice?
Yes, it does help my patients, especially because I have to get I have got a very fast OPD, and I have got all this.
It will take more time because.
Yeah. No, it won't take time because I can now train more people around me who can get these calculations, and they can.
My point is that how does it help your patient medically?
Directly,
not from
yes.
yeah.
Directly also it does help me. Like sometimes when there is nystagmus and ESO, even I have been practicing strabismus since 15 years. Still, I make some mistakes when I'm doing this fast motions, esotropia with nystagmus or DVDs. So even I miss it sometimes. So when I did this, I found that it was very useful for me.
More so be helpful in the treatment to the patient, like if you give video to the patient. Can it
Yes,
be
sir.
helpful?
Yes, sir. Of course, it can help the patient. Yes, sir.
So probably even using a mounted kind of a thing would be better, but you know that is negated because you have you have the optical stabilization nowadays on most of the phones. So I think,
there were new smartphones and all those things, technology.
yeah, the OIS is there. Yeah, the optical stabilization is there. So
We are recording these videos, but they are very costly machines and phones we have in our hands. So we can use these.
no, see the phone does post-image processing. It does post-video processing.
Yes, yes.
So it does the auto-correction. I think this is the best device that you should be using actually.
Yes, sir. It came out.
I think it's a very innovative idea.